Welcome back. This is Dr. Craig from Craig Wellness and Recovery. Last week we talked a little bit about the opioid epidemic, so I won't revisit that. But today I'd like to talk a little bit about the disease of addiction. There's a lot of misconceptions about what addiction is and what it's not in our community. Here at Craig Wellness and Recovery, we specialize in the treatment of the disease of addiction. As a board-certified addiction medicine physician and board-certified family medicine physician, I've dedicated my life to treating nothing but the disease of addiction. What we know about addiction now is that it is a primary brainstem disorder. Primary meaning nothing else caused it. It wasn't secondary to anything else. What this means is that drugs don't cause addiction. No more than sugar causes diabetes. So what I'd like to get across today is the general idea and approach to the disease of addiction needs to be a medical one. It needs to be an emotional one. It needs to be a psychiatric one. And first and foremost, we need to recognize this as a primary brainstem disorder. The issue in the brainstem of the addict is dopamine insufficiency. Dopamine is a neurotransmitter that's produced from tyrosine, and when it's deficient in the brain of the addict, causes what recovery calls restlessness, irritability, and discontent with the world. This is not the choice of the addict. And in this way, when they use drugs, they actually increase their dopamine. So drugs don't seem to be the problem. Drugs fix the problem. And that's the problem, because they stop working. And when they stop working, that's when we see the severe problems. So we need to really address this brainstem disorder, and we need to first and foremost be compassionate towards the addict. At any rate, if you have an addict in your life, then love them until they can love themselves. And if you're an addict yourself, please do the same. Thank you. Here at Craig Wellness and Recovery, we love you. There's nothing you can do about it.